What is going on, guys? Welcome to another video on my channel, Hairlicious. If you guys are new, make sure to subscribe and stay updated on the latest hair loss news. Today, I actually wanted to talk about something known as low-level laser therapy and its benefits in treating hair loss. When it comes to lasers, there's a lot of people that simply think that it doesn't really work in treating hair loss, and that it's simply a sham device that is out there to, rob people of their money. And I feel like the majority of the people that are saying this simply have not used low-level laser therapy for the treatment of androgenetic alopecia in both male and female patients. And the thing is, I've actually seen some pretty good results of people using lasers to treat hair loss. And now there are actually some pretty good scientific studies behind the low-level laser therapies that prove its efficacy in treating hair loss. So what actually happens is that low-level laser therapy utilizes red lasers between the frequencies of about 630 to 670 nanometers. And a Hungarian doctor from the 1970s initially tried to see if these red lasers would help reduce skin cancer, but instead he found that it actually promoted hair growth. So that's kind of like the history behind what pretty much started this whole laser therapy for treating hair loss. And the mechanism of action in low-level laser therapy for treating hair loss works by, first of all, stimulating the anagen phase in telogen hair follicles, and then also prolongs the anagen phase, and it also increases the rate of proliferation in active anagen hair follicles. The exact mechanism isn't fully known, but evidence does suggest that the lasers also enhance gene activity and decreases something known as apoptosis by targeting the cytochrome C intracellularly, which in turn increases vascularity in the blood. Now, there's a ton of studies that are done on low-level laser therapy. There is a famous one in 2018 that tested the efficacy of lasers for the treatment of androgenetic alopecia in both men and women in a 24-week randomized, double-blind, sham device controlled study. And what happened was, after 24 weeks, the study concluded that the laser cap showed a significantly greater increase in not only hair density, but also hair diameter when it was compared with the sham device. And there was another study. It was a multi-center sham device, double-blind controlled study that was using a comb device 3 times a week, and it showed improvement over a 6-month period at a statistically significant level of not only hair count, both qualitative and quantitative. The increase in terminal hair density was independent of age and sex of the subjects who were using the laser comb. So I wanted to show you guys the one that I have been using. This one here is the 272 laser diode cap, and its wavelength is set at 650 nanometers, and it comes equipped with this battery pack. And one of the nice things about this is that it is so discreet. You can use any cap that you want. And it's recommended 3 times a day, 30-minute sessions. But I find that the most effective way to promote hair is to use it on a daily basis. So what I like to do is I like to switch between 30 minutes and, the following day I do 7 minutes, and I switch 30 minutes to 7 minutes, and so on and so forth. So this thing right here is actually the full 272 medical grade laser diodes. And the good thing is that it is not LEDs. LED lights tend to spread out, and a lot of the energy gets wasted, and it can't really be concentrated or pulsed like the lasers can. So with LEDs, it's actually impossible to focus the light on specific areas on the scalp. Which also means that LEDs cannot penetrate the scalp to the extent that these lasers can do. So my laser cap is also FDA cleared, and while there are a lot of similar ones, not all of them are going to be FDA cleared. Now, the reason why it's FDA cleared and not FDA approved is because lasers are actually Class 2 medical devices, and these only require that it be FDA cleared, versus Class 3 medical devices, which would require the FDA to be approved. And these are usually things that can significantly affect your health, such as, like a pacemaker. If that doesn't work, then it's going to cause a lot of significant damage to a person, even result in death. That's why it has to be FDA approved, versus these Class 2 medical grade laser diode caps, which are only requiring it to be FDA cleared. So here are some before and after photos of people who have actually had great success when using low-level laser therapy to treat hair loss. So then you guys might wonder, who would be a good candidate for low-level laser therapy? Simply put, anybody who is suffering from hair loss, particularly androgenetic alopecia, in both male and female patients would be great candidates, and they have seen great results. A lot of people who have suffering from chronic shedding can also see great results, since the lasers are going to increase the anagen phase of the hair follicles. People that use low-level laser therapy, especially after a hair transplant, in my case, this is also great because the lasers are going to help maintain the hairs that were implanted along with the native hairs, and it's also going to help with the growth process right after a hair transplant. And so a lot of people are recommended to use these low-level laser therapies before and after, and even long-term, for treating hair loss. And one of the best things about these low-level laser therapies is that there are no negative side effects. There are nothing. You might suffer from some shedding in the initial phases because of the fact that the hairs are transitioning to an anagen phase, but it is a great arsenal to add to somebody who is suffering from hair loss. And with anything, I believe that this works even better synergistically with other types of hair loss medications that are currently FDA approved, such as minoxidil and finasteride, because they do work in different mechanisms of actions, and by covering different things that can cause your hair loss, you're covering your base and you're equipping yourself with the best tools to combat hair loss. So no, I don't think that it's a waste. I don't think that just minoxidil and finasteride is just going to be enough. If you were to include lasers, I believe that you are going to see better results. So if you guys have any questions, make sure to leave us some comments. Check out hairliciously.com to take a look at my laser cap and get your very own. Make sure to use promo code hairliciously2019 to get 5% off. And I will also be having vitamins, which will be coming up shortly in the next few weeks, and I will be making a video to give you guys an update. So make sure to stay subscribed, and if you guys have any questions, make sure to leave them in the comment section below, and I will talk to you guys next time. Take care.